I'd like to drill down a little more about how these factors such as race or poverty affect outcomes. And, you talk about this intergenerational effect. Can you give me some examples of what you mean by that?
Yes, let me start with the second part of your question, the intergenerational effects that, in fact, are particularly evident and prominent when you think of the health of a mother through a life approach lens. So that means that whatever happens during pregnancy is closely related to the health behaviors sorry, and the conditions that the woman lived in before pregnancy. And they also affect her health and wellness after pregnancy. And sometimes, as we were saying, also the next generation. Let me give you an example. If a woman doesn't get a good nutrition during childhood, she'll probably won't reach a mature body at the time she delivers. And she may have complications as a result of that. And the baby may die or be seriously ill because, whenever the delivery happens, it won't be able to go through the birth canal in a healthy and normal fashion. So the malnutrition that the woman had during her childhood affects her in later stages of her life, including the maternal health period, and it also affects the baby. Let me use a positive example. If a woman, for example, gets the human papillomavirus vaccine in late childhood, early puberty, she will be able to prevent cervical cancer much later in her life, 20, 30 years later in her life. So all these stages are connected, and they are also connected, as we were saying, to the next generation. But unfortunately, very often we in medicine and other public health sciences siloed the life of individuals into specific stages. So we specialize in looking at childhood illnesses or adolescence health or maternal health or the health of older people, while all these stages are so closely connected biologically and also socially and psychologically. So in order to truly support women to achieve health and wellness, we need to look at them comprehensively. Let me give you a last example of the impact of a condition on both the mother and the baby. If a woman has gestational diabetes during pregnancy, which is a quite common condition, during the pregnancy itself, she faces the risk of complications, and the baby may also have complications. But even beyond that, her risk of becoming type 2 diabetic, that's the chronic type of diabetes increases by 60% in the following 5 years. So it's not that you can look at women or men, for that matter, in little pieces. You need to connect the dots and look through the life course.